Gonococcal urethritis from the word gonococcal. Gonococcal. That means gonorrhea. Gonococcal urethritis. So that means that it is caused by gonorrhea. That is the buzzword. So when you see in the exam gonococcal urethritis, so this is that UTI that is, or like we said, remember we were describing about when the person is less than 35 years, when they are greater than 35 years. So gonococcal urethritis shows that it is caused by gonorrhea, that Neisseria gonorrhea. But non-gonococcal from the word non-gonococcal. So in case you see in the exam non-gonococcal, so non-gonococcal is it is not caused by gonorrhea. So that will be caused by chlamydia or other of these that is mentioned here. Okay, so when you have question on the treatment for gonococcal and non-gonococcal, so if it is gonococcal urethritis, the answer will be ceftriaxone because you are treating them for gonorrhea, and we say that it is transmitted by what? It is sexual transmission. So both of them are sexually transmitted. But the only difference is when you hear gonococcal. So gonococcal means it is caused by gonorrhea. And because it is caused by gonorrhea, you are going to give them ceftriaxone.
Rocephin.
But Rocephin. But if it is non-gonococcal, so non-gonococcal means is chlamydia. So what you are going to use for that is
Toxic
doxycycline or
or azithromycin.
azithromycin. So let me just repeat what I said again. When you have gonococcal, gonococcal means it is caused by gonorrhea. It means it's caused by gonorrhea. So what we are going to give them is ceftriaxone. But when you have non-gonococcal, non-gonococcal means it is not caused by gonorrhea. So it is caused by chlamydia or any of these organism or virus that is mentioned, but gonococcal is gonorrhea, non-gonococcal is chlamydia. So if they ask you a question on non-gonococcal, then the treatment will be doxycycline and azithromycin. So this is an example. A 30-year-old man presents with vaginal discharge and pain during urination. He is diagnosed with non-gonococcal. So non-gonococcal means it is not caused by gonorrhea. So the man is diagnosed with non-gonococcal urethritis. Which of the following is the most appropriate initial treatment? So because we said non-gonococcal means it is caused by chlamydia, so the answer will be doxycycline. That's the
Doxycycline.
treatment for doxycycline. So that would be doxycycline because it's doxycycline. But the next question is a 25-year-old man present to the clinic with dysuria and a clear urethral discharge. Dysuria and a clear urethral discharge. He denies any recent sexual activity or trauma. What is the most likely causative organism for his symptoms? So if you look at the buzzword, this person is 25. So because patient is 25, so we'll be thinking that this will be STD. But they said it is dysuria, so that means painful. Remember that chlamydia is, they will say it hurts when I pee. It hurts when I pee. It's hurting me when I'm peeing. So that is dysuria, painful urination. And then clear, anytime you see anything chlamydia is usually clear discharge or white discharge, but something like gonorrhea is greenish discharge.
Greenish.
So because they said clear discharge, So that will be chlamydia. So
Chlamydia.
non-gonococcal is the most commonly caused by chlamydia trachomatis. This infection usually present with dysuria and a clear urethral discharge. So this is another question. Which of the following is a reasonable treatment option for 30-year-old man with acute epididymitis? Somebody that have acute epididymitis who present without gastrointestinal upset and will be treated as an outpatient. So the buzzword here is that this patient is 30 years old. And we say that when a patient is less
Less than
than
30.
35
35.
years old, so because this patient is 30 years old, then the treatment will be doxycycline. Yeah, with ceftriaxone because the patient will be treated at STD.